So, just to recap, in part one, I described my experience with two visits for stays at the psychiatric ward. What I want to talk about now was what our current healthcare system and the hospital were able to provide once I was out. And sadly, due to financial budget restrictions with the government, this program actually has been since shut down. But anyway, they called it day therapy. And day therapy wasn't only for people that were formerly patients in the hospital, it was also for people that were sent to that method of support by their psychiatrists as well. So it was always held in a group setting. It was 2 times a week, and the sessions were 2 to 3 hours long. Now, they were during regular business hours, so anyone working, would have a challenge with it. Though, I guess it's no big surprise that most people I encountered throughout both the hospital aspect and the day therapy aspect were not gainfully employed. So they were on long-term disability, retired, whatever. So it didn't seem to interfere with their ability to access the support. Now, the day therapy part was all group sessions. And I'm personally not a big fan of those. I mean, yes, they have their place for me personally, but it's not really a forum focused on your specific fears or areas of sadness or your history. And I personally benefit from talk therapy, from just repeating how I feel and being challenged on my thoughts or my comments by someone who's paying attention. So the group atmosphere isn't necessarily the best for that. All of these people exhibited the same sort of needs that I have and that you have. So the sessions were built in such a way that you would still, if needed, visit one-on-one with your psychologist or social worker, and in my case I did both. And then there were the group sessions where there was reading material provided every week, exercises provided that you were expected to do, and come ready to the next group session to offer your responses. Not in a classroom type of scenario, but just, exercises and that sort of thing. So that was educational. It was a very relaxed setting. We didn't always have the same person leading each group. Obviously, in a hospital environment, they had specialists. So overall, day therapy was a secondary but very well structured program that was in place. And I must say the staff, just like inside the ward, were exceptionally kind. And it was a type of thing where, they definitely placed the onus on us for attendance and reading the materials that they provided. I think I wound up with a binder about that thick of photocopy material that came from various textbooks and that sort of thing. So you had to take ownership for it, and regular attendance was required. And if you didn't attend, I think more than 3 of the sessions, then you couldn't come back until that particular course was offered again. And they usually lasted about 7 to 8 weeks per course. So it was a very good transitional forum, I found, coming from a hospital setting to that, and then still having my own psychiatrist, and still now having a social worker and a psychologist to talk to for the one-on-one stuff. So in a way, I had the best of all worlds when it came to support. So it was great, but unfortunately, with government cutbacks in the healthcare system, the day therapy program has been shut down. And some of the individuals I was actually working with, like my psychologist and social worker, were, I think, laid off. So very disappointing. But then in a healthcare system, what can you expect? There's never enough money to cover everything, and they have to put the money into the most critical resources. And certainly keeping the hospital psychiatric ward up and running and functioning for the most severe cases takes trumps the rest of us that can get these resources from EAP or community-based groups and that sort of thing, which is what I'm involved with at the moment. So there's my spiel too of hospitalization and the step down program, the day therapy program following hospitalization. I think I've already shared everything that I learned, at least the things that I remember. It came off the top of my head. Again, as your tip, don't be afraid of it if it's offered to you. If it's offered, it's probably for good reason. Mental health care professionals always need to keep a wary eye on suicidal tendencies. Should approach your healthcare professional and say, look, I really feel like I'm spinning out of control here, so maybe I ought to be admitted for a period of time to the hospital. The one good thing is, again, they pass you off, at least where I live, to a new psychiatrist to reevaluate your situation. So if you've been working with the same professionals for a while and you don't seem to be making any progress, it may not be their fault, but it's always worth a second pair of eyes. And those are the actual words of my own psychiatrist. And of course, they are kept in the loop, so that when you go back to your psychiatrist, they are aware of the things that you've been through. So I do hope this has been helpful, as always. If there's been a little background noise in this video, I apologize. It was unintended, but that's what you get when you don't live alone. And I hope you have a fantastic day. One of these days I'll get this eyesight camera figured out. Anyway, have a good one.